Hello, myself SAURAV Payal, and today I'll be talking about the family planning counseling. So it plays a major role in planning a family, and it is basically done through a method called as gather method, and it is the key to reduce the burden on the on a family because they can plan their family according to these methods, and it is the process where we help our clients and people in the village to make informed and voluntary choices about the number of people they want in their family. And there are several different ways of doing this, and with this method a male and female can choose their effective way of planning their family. Female sterilization. It is an operation to permanently prevent the pregnancy, and the fallopian tubes are blocked or sealed to prevent the eggs from reaching the sperm, and these become the fertilized. And some facts about the female sterilization, like it confirms about the 99% of effectiveness at preventing the pregnancy, and a female cannot don't have to think about the sex after this method because it does not interrupt the sex life, and it does not have any impact on the hormone, and the female still have the periods. And as with the surgery, there is a small risk such as internal bleeding and some kind of infection or damage to the other organs. In this method, the surgeon will block the fallopian tube, called as the tubal occlusion, by two types, like by applying the clips, which are the plastic or titanium clamps, which are closed over the fallopian tubes. And second is the rings, applying rings. A small loop of the fallopian tube is pulled through a silicone ring, and then clamps are shut down. And third one is trying or cutting or removing a small piece of the fallopian tube. This can also help in this. Male sterilization, it is called as vasectomy. It is a surgical process to cut or seal the tubes that carry the male sperm to permanently prevent the pregnancy. It is usually carried out under the local anesthesia. And some facts about the vasectomy. It is also like 99% effective, and it is considered to be the permanent. So once if it's done, then we don't have to think about the contraceptives again. And as with any surgery, there can be a small risk of infection, and in this condition it is difficult to reverse this condition. So if a person is doing this process, then he must be sure about the outcomes. And a vasectomy does not protect against the STDs, so they need to use condoms as well. And how it works: so a vasectomy works by stopping the sperm getting into the female semen, man's semen, and the fluid that he ejects. And the tubes that carry from a man testicle to the penis are cut and blocked or sealed with the heat. This means when a man ejaculates, the semen has no sperm in it, and a woman's egg cannot be fertilized. Vasectomy, it is a quick and relative painless surgical process. There are two type of vasectomies. First one is conventional vasectomy, which is using a scalpel, and second is no scalpel vasectomy.